Thank you for listening to my e-poster entitled Learning Needs of General Internal Medicine Subspecialty Residents in Ambulatory Care Education. Given the fact patients are facing increasing complexity and chronicity of their illness, coupled with the fact that the healthcare system is limited, care is being shifted from the inpatient to outpatient setting. Many internal medicine programs do not have a formal curriculum in ambulatory care education. The majority of training remains inpatient focused. The purpose of this study is to understand what are the learning needs of GIM subspecialty residents in ACE, how are GIM residents receiving their ambulatory care training, and what is the role of the ambulatory internist in Canada. The population of this study are our GIM residents who are completing their half-day longitudinal clinics throughout PGY 4 and 5. A qualitative approach is used using constructivist grounded theory. Data collection and analysis occur in a simultaneous and iterative fashion. 8 semi-structured interviews of our current trainees have been completed and thematically analyzed using constant comparison. The ambulatory environment presents unique challenges to both trainees and educators alike. This is reflected in the emergent themes of this study. I will now focus on several themes that I thought to be of particular interest. Trainees strongly felt that longitudinal relationships with both their patients as well as their attendings were important for their growth. One participant discusses his need for his preceptor to be able to see more than his medical knowledge from case to case. He would like them to see his overall growth in some of his managerial skills related to documentation and clinic flow. Another theme centers around the desire for increased autonomy while providing outpatient care, similar to the autonomy experienced by the trainee when inpatient care is provided. Trainees are finding that there is often duplication of work in the ambulatory setting, and the supervisor can be very hands-on, especially when there's not an existing working relationship between trainee and supervisor. I would also like to highlight the theme that GIM residents found Canadian ambulatory internists to be complex medicine specialists who work to support primary healthcare providers as well as prevent admissions to hospital. The need to manage the entire patient was underscored and contrasted against some specialists who provide regional care. Short exploration of emergent themes will continue to evolve over time as theoretical sampling is used to achieve data saturation. The next steps in this study include triangulation of this information with recent graduates. These insights will then be used in development of ambulatory care education curricula for GIM subspecialty residents with the Ambulatory Working Group and collaborators at Queen's University.